Indigestion. Well, it is also called dyspepsia or an upset stomach. And indigestion is discomfort in your upper abdomen. It describes certain symptoms such as abdominal pain and a feeling of fullness soon after you start eating, rather than a specific disease. Indigestion can also be a symptom of various digestive diseases. Although indigestion is common, each person may experience indigestion in a slightly different way. Symptoms of indigestion may be felt occasionally or as often as daily. Indigestion may often be relieved with lifestyle changes and medications. Symptoms. Okay, if you have indigestion, you may have early fullness during a meal. You haven't eaten much of your meal, but you already feel full and may not be able to finish eating. And second symptom can be uncomfortable fullness after a meal. The feeling of fullness lasts longer than it should. Also, there may be discomfort in the upper abdomen. You feel a mild to severe pain in the area between the bottom of your breastbone and your belly button. Burning in the upper abdomen. You feel an uncomfortable heat or burning sensation between the bottom of your breastbone and your belly button. Also, there may be bloating in the upper abdomen. In this, you feel an uncomfortable sensation of tightness in your upper abdomen. Nausea. You feel as if you want to vomit. There are less frequent signs and symptoms that include vomiting and belching. Sometimes people with indigestion also experience heartburn. Heartburn is a pain or burning feeling in the center of your chest that may radiate into your neck or back during or after eating. Mild indigestion is usually nothing to worry about. Consult your doctor if discomfort persists for more than 2 weeks. You should contact your doctor right away if pain is severe or accompanied by unintentional weight loss or loss of appetite, repeated vomiting or vomiting with blood, black tarry stools, trouble swallowing that gets progressively worse, fatigue or weakness which may indicate anemia. You should seek immediate medical attention if you have shortness of breath, sweating or chest pain radiating to the jaw, neck or arm. And because sometimes patients come to us with these kind of symptoms, and these symptoms may be indicating something serious, okay, like a problem arising in the heart. But there are times when people come with this symptom, we feel that it's a problem of indigestion, but actually the problem lies far deep, okay. So you should be careful about the symptom which I just told you, okay. Also, you should seek immediate medical attention if you feel chest pain on exertion or with stress, okay. Now I will discuss about the causes. Indigestion has many possible causes. Often indigestion is related to lifestyle and may be triggered by food, drink or medication. Common causes of indigestion include overeating or eating too quickly, fatty, greasy or spicy foods, too much caffeine, alcohol, chocolate or carbonated beverages, smoking, anxiety, certain antibiotics, pain relievers and iron supplements. A condition known as functional or non-ulcer dyspepsia, which is related to irritable bowel syndrome, is a very common cause of indigestion. Well, on this channel, I have already uploaded a video about irritable bowel syndrome that is very informative. You can see that video, okay? Sometimes indigestion is caused by other conditions that include inflammation of the stomach, that is gastritis, peptic ulcers, celiac disease, gallstones, constipation, pancreatic inflammation, that is pancreatitis, stomach cancer, intestinal blockage, reduced blood flow in the intestine, that is known as intestinal ischemia, diabetes, thyroid diseases, and pregnancy. And most of the illnesses which I have just told you, I have already uploaded videos about those illnesses, okay. So you can see those videos. Now I'll tell you about the complications. Although indigestion does not really have serious complication, it can affect your quality of life by making you feel uncomfortable and causing you to eat less. You might miss work or school because of your symptoms. Okay. Now coming to the diagnosis of indigestion. Well, when patients come to us, we are likely to start with a health history and a thorough physical exam. Those evaluations may be sufficient if your indigestion is mild and you are not experiencing certain symptoms such as weight loss and repeated vomiting. But if your indigestion begins suddenly and you are experiencing severe symptoms or you are older than age 55, then we may recommend lab test to check for anemia or other metabolic disorders. breath and stool test to check for Helicobacter pylori, the bacterium associated with peptic ulcer, which can cause indigestion. Endoscopy also we can advise, that is to check for abnormalities in your upper digestive tract, particularly in older people with more persistent symptoms. A tissue sample, that is biopsy, may be taken for analysis. We may also recommend some imaging tests such as X-ray or CT scan to check for intestinal obstruction or another cause. Okay, now I'll tell you about the treatment of indigestion. Well, lifestyle changes may help ease indigestion. We may recommend avoiding foods that trigger indigestion, eating 5 or 6 small meals a day instead of 3 large meals, reducing or eliminating the use of alcohol and caffeine, avoiding certain pain relievers such as aspirin, ibuprofen, and naproxen sodium, finding alternatives for medication that trigger indigestion, controlling stress and anxiety. If your indigestion persists, medication may help. Over-the-counter antacids are generally the first choice. Other options include proton pump inhibitors, which can reduce stomach acid. Proton pump inhibitors may be recommended, particularly if you experience heartburn along with indigestion. And I frequently prescribe this medicine known as Nexium, and that is very helpful. The generic name for Nexium is S-omeprazole. Okay, and there are so many variants of omeprazole, and we prescribe omeprazole for usually for the symptoms of heartburn. Okay, then we may prescribe H2 receptor blockers such as ranitidine, which can also reduce stomach acid. Also, there are medicines which are called prokinetics, which may be helpful if your stomach empties slowly. Antibiotics, which can help if H. pylori bacteria are causing your indigestion. When the patients usually come to me in my clinic, and then I usually tell them that the indigestion or this dyspepsia can be of two types, like it is associated with bacteria or it's non-bacterial problems. Okay, so in those cases, especially people who present with symptoms of indigestion again and again, we usually recommend H. pylori test, and if it is positive, then we have to start antibiotic course to eradicate H. pylori, because that is very important. Okay. Also, in some cases, we may prescribe antidepressant or anti-anxiety medications, which may ease the discomfort from indigestion by decreasing your sensation of pain. Okay. Coming to the lifestyle and home remedies, mild indigestion can often be helped with lifestyle changes that include eating smaller, more frequent meals. You should chew your food slowly and thoroughly, avoiding triggers, fatty and spicy foods, processed foods, carbonated beverages, caffeine, alcohol, and smoking can trigger indigestion. Maintaining a healthy weight. Excessive pounds put pressure on your abdomen, pushing up your stomach and causing acid to back up into your esophagus. Exercise regularly. Exercise helps you keep off extra weight and promotes better digestion. Managing stress. Create a calm environment at mealtime. Practice relaxation techniques such as deep breathing, meditation, or yoga. Spend time doing things you enjoy. Get plenty of sleep. Also, sometimes changing your medication may help. With your doctor's approval, stop or cut back on pain reliever or other medication that may irritate your stomach lining. If that is not an option, be sure to take these medications with food. Well, now I'll tell you some role of alternative medicine. Well, alternative and complementary treatments have been used for many years to ease indigestion, although their effectiveness varies among different individuals. These treatments include herbal therapies, including plain peppermint or a combination of peppermint and caraway oils, and the Japanese herbal formula Riconshito. STW5, that is comes with the name of Ibrogast, that is a liquid supplement, contains extract of 9 herbs, may work by reducing the production of gastric acid. Acupuncture, which may work by blocking the pathway of nerves that carry sensation of pain to the brain. Psychological treatment, including behavioral modification, relaxation techniques, cognitive behavioral therapy, and hypnotherapy are often very helpful. Always check with your doctor before taking any supplement to be sure you are taking safe dose and that the supplement won't adversely interact with any medication under the medication you are taking. Well, on YouTube channel there are so many channels which are promoting some unlicensed products. Okay, you should always consult with a qualified doctor. For example, I am a qualified doctor, and Also, you should not fall into the traps of so many quacks and YouTubers who are promoting different products. And because if you take products, especially some people make a mistake of taking these so-called herbal or products along with the medicine prescribed by the doctor. So these interfere with each other and they may cause serious side effects.